Distinguished guests, ladies and gentlemen, so once again, welcome to our Focus Point Read Show. So just now, we already had a very interesting sharing. So right now, we have another sharing session, which would like to talk about a closer look at blurry vision. And for this sharing, we have invited Mr. Mohd Zharif, the training manager from Focus Point Vision Care Group, to share more information with us about this topic. So for those of you who would like to have more knowledge on this topic, do drop by here and also to listen to this talk. So welcome, Mr. Zharif, and would like to invite you to dive deeper into this topic.
Okay, good afternoon, everyone. Okay, so before that, I introduce myself first. My name is Mohd Zharif. So I'm the training manager from Focus Point. Okay, working experience about 14 years. Okay, I'm graduated for both my bachelor and master from UKM. Okay, okay. So when we talk about blurry vision, so this is the things that I will cover today. So what is actually a blurred vision? What need to be aware of? What causes blurred vision and the management of it? Okay. Okay. So basically, what is actually a blur vision? Yeah. So blur vision is an eyesight less sharp, so that the object, the image, the words seem to be out of focus. Okay. Why I give you this definition? Because some of the customer, when they come to the outlet, they say they have double vision. Okay. But double vision and blur visions are two different things. Yeah. So double vision, normally you see two things separate into two. Okay. It can be, but blur vision, normally it's the things is out of focus. Yeah. So it's become blurry. Yeah. So like the image at the side there. Yeah. Okay. So when you have a blur visions, there are a few things that you need to know. Okay. So first is the location and the laterality. So sometimes when customer come to the outlet, we ask, you have blur visions for distance or near, so they are not sure. Okay, you blur at one eye, right eye or left eye, they also not sure. Okay, so these things you may think to consider. Okay, so the blur vision can happen in one eye, which is monocular, or it can happen on both eyes, which is binocular. Okay, and it also can happen in different distance. Some people, they have blur visions at far, but they are definitely fine seeing at near. Okay, but in some certain cases, they are blurring only at near, but they can see very, very clear at distance. Yeah, and in unfortunate one, they blur at both sides. Okay, so both distance and near are blur. Okay. So the next thing you have to know about blurry visions is the onset. Okay, when it started. Okay. So we are more cautious if the blurry visions happen suddenly. Okay, let's say you wake up in the morning, then suddenly you cannot see things. Yeah? Everything blurry. That one you might be more cautious. Yeah, but if it's gradually, so it happen every time. Over time, it become chronic. Over time, it become more blur and blur. So that is gradual. Okay, so certain cases maybe like short-sighted. Yeah, short-sighted, sometimes it become blurry gradually. Yeah, you rarely seen people who have short-sighted then wake up in the morning, suddenly they cannot see. Yeah, but if you have same thing like cataract, cataract normal, the blurry visions happen gradually. Okay, but in certain cases like retinal detachment, okay, yeah, just now the doctor mentioned, yeah, retinal detachment, it can happen suddenly. Yeah, and even some eye infection. Okay, the optic neuritis, the inflammation at the optic disc, it can happen also suddenly. Yeah, so normally the one that is related to medicals, it can happen suddenly. Yeah, so that is the thing that we are more cautious and we need more further investigation. Yeah. Okay. So the next thing that you have to know is the severity of the blurry visions. Okay, does it happen transient? Transients meaning that it on and off. Okay, so if your blur vision is on and off, it may indicate the things like dry eye. Okay, because dry eye, normally the blurry visions, it best or it improved by blink of eye. Okay, So if you blink your eyes, then you see clear, then after sometimes it will blur back. So it may be related to dryness. So it's transient, it's not constant. Yeah. So constant is all over the time, from morning, wake up to the night, the blurriness is the same. Okay. So this is the thing that you have to check first. Okay. Other than that, I think you have to know also the associated sign and symptom lah. Okay. So if your blur visions come together with the pain, okay, and it come together with the eye redness, yeah. So you have to bear in mind, and you need to seek for a medical attention, yeah. So like the Dr. Malisa also mentioned just now about redness, yeah, about pain. So it's indicate a further investigation to know about the root cause of the blurry of visions.
Yes, you have given us a basic knowledge about blurry vision, and would like to also get to know information about what actually causes blurry vision.
So it can be multiple things, okay? So the cause of blurry vision, before we go to that part, yeah, I think it's good if we can get to know the eye first, yeah? So this the eyeball, okay? So basically we can only see if the light can pass through the eye, okay, and reach the retina, yeah. So the front part, which is the curvature at the front, we call that as a cornea, okay. That is the transparent layer of your eyes, okay. And in the middle, you can see that bulgy things there. That is a retina. That is the crystalline lens, okay. So the lens should be clear, and you have in the middle the orange there is the vitreous, and the last at the back is your retina, okay. So the light should be able to pass through from the front up to the back, okay. If anything happen in middle, in between, yeah. So let's say your cornea, you have opacity in the cornea or scarring at the cornea, or your lens have opacity, like you have cataract in your lens, okay. It will block the light halfway, okay. So the retina cannot reach, the light cannot reach to the retina, okay. Or if your retina have abnormalities, example like you have retina detachment, okay. You have macular degenerations, or you have macular inflammations, yeah. So this thing can cause the blurriness, yeah? So to understand easier, so the retina is actually like the film in your camera lah, yeah. So the cornea and the lens is like the front lens, so you adjust the focus, but the retina is actually the film at the back. So this is the area where you receive the light and the image come out, yeah. So if you have a crimple, not good film, the image also become not very good, yeah. Okay. So the cause of blur vision, it can be because of the eye condition, as I mentioned before, okay. It can also become because of the medical conditions, yeah. So eye condition, it can be because of refractive error. So the refractive error is the most common blurry of visions lah. Refractive error is the short-sighted, long-sighted, astigmatism, yeah. So that is the most common cause of blurry of visions, yeah. Next is the dry eye. The dry eye, normally it can happen suddenly or gradually, and most of the time it is transient, yeah. So cataract, the blurry of vision progress over time. Okay, by the time the cataract become more mature, it will be more blurry. Yeah. So damage to the cornea, as I mentioned, if there is anything happen to the cornea like cornea scarring, that can also cause blurry of visions. Okay. Problem in the retina. So as mentioned before juga, the retina is the film. Okay. So if your retina have problem, you have also problem receiving the good image. Yeah. So any eye infections or eye injury, okay, let's say you have a blowout fractures, you play football, then the ball bump into the eyes, yeah. So your eyes are swollen, everything. That is also can cause blurry of visions, yeah. And eye infection. So the most common eye infection is conjunctivitis lah, or corneal ulcer, yeah. So in medical conditions, you have to bear in mind also, if you have diabetic, which is not in a good control, yeah. So as your sugar level increase, sometimes your power also become fluctuating, yeah. So if you are coming to a spectacle outlet, you want to check your power, make sure your sugar level are stable also. Yeah. So don't be surprised. Let's say you come to the shop, make a spectacles check, then you collect the spectacle. During that collections, your blood sugar is high during that time. So you wear the spec, you feel blur. So that blurry of visions can also because of the diabetic. Yeah. So the diabetic actually can do the refractive error fluctuate. Yeah. So some other medical like migraine, stroke, yeah. So these things also can cause blurry of visions. Yeah, brain tumor, preeclampsia is the problem that happen in a pregnant woman. Okay, so because of the hormonal changes happen during your pregnancy, sometimes it can also cause blurry of visions. Yeah, so you also know that when you are pregnancy, you also you have a higher risk of getting a diabetic during a pregnancy. So that is also the reason. Yeah, and a head injury. So head injury maybe. You have motor vehicles trauma, okay, motor vehicle accident. That one also can cause when things happen, bump into the head. That can also cause blurry of visions. Yeah, I think that is all the cause. And so I hope I answer your questions. Yeah. So next is the management. Okay. So the management, in order for us to manage your blurry of visions, so we have to know the cause of your blurry of visions. Yeah. So in focus point, we are doing this APEC 360 APECs, which include all the 8 step of examination. Okay, it started from history taking, color vision testing, binocular vision testing, slit lamp, eye pressure, retinal testing, and with consultation. Yeah. So we cannot give a proper consultation if we don't have enough information about the customer. Yeah. So by doing all these tests, we get more information about the eye condition, about your health condition, so we can give better consultation to the customer. Yeah? So if you have underlying medical cause, yeah, so like diabetic, hypertension, cholesterol, which is not in good, so medical assessment may be needed. Yeah. So, and if the treatment of blur vision, yeah, so I mentioned just now, the blur vision treatments, it depends on the cause. It may include a vision corrections, okay, which is spectacles, okay. It can also include an eye drop for a simple case like dry eye, okay. It can also include surgery or medicine, yeah. So like acute glaucoma, example, yeah. Glaucoma is the condition where you have a damage in your optic nerve, and the risk factor of it is high eye pressure. Yeah? So when you have this, so some medication can be prescribed by the eye doctor to control the eye pressure. Yeah? I think that's all from my part. Okay.
Yes, just for one extra question for you as well. So any other lifestyle factors that can worsen or actually improve blurry vision?
So the lifestyle, normally the lifestyle I can only cover a bit about all the eye conditions, okay? So because the medical condition as usual, you have to make sure your body are healthy, yeah? So general health are also related to the eye health, yeah? So if you have diabetic, if you don't have this disease, is even better, yeah? So next is about the eye condition. So if you are a contact lens wearer, yeah? So make sure your contact lens, you are taking care of the hygiene of your contact lens properly. Okay, don't buy over the internet. Okay, okay. So for your information, contact lens is a medical device. Yeah, so it's not things that you can buy over the counter or buy over online. Yeah, so you need to have a proper examination about the contact lens because not every eyes are the same. Okay, some contact lens may fit properly in the eye, but some contact lens may fit loose or stiff in the eye. Yeah, so when this happen, it can further or progress into other eye complications. Yeah, which can lead to blurry of visions also. Okay, and without proper care of contact lens, you also have the higher risk of eye infections. Yeah. So other than that, I think you have to bear some lifestyle like outdoor activities, less screen time, proper diet. Yeah, that things can also help in managing your blurry of visions. Yeah.
Thank you, Mr. Zharif, for sharing with us useful tips, and I believe that many of you have really gained more information about Blurry Vision. So once again, thank you. And also for those of you who would like to have some consultation, and also if you do have any question to ask, so Mr. Zharif will be here as well in our Focus Point Rickshaw. So do check us out and also find out more information in our Focus Point Rickshaw. So thank you once again. Thank you for the important information.